In this chapter, we're mostly going to focus on the physiology of the heart. The heart is located within what's called the thoracic cavity. The thoracic cavity is everything that lies internal to what's called the chest wall. The chest wall is made up mostly of the ribs, the muscles that lie in between the ribs, the intercostal muscles mostly, and finally the thoracic vertebrae. Okay, so that's mostly what makes up the chest wall. Inside of the chest wall, we have what's known as the thoracic cavity, and we can clearly see what's in the thoracic cavity is mostly the heart and the lungs. The lungs are coming next after we do the entire cardiovascular system, but for now we're focused on the heart, and the heart is within this thoracic cavity. A couple things about the heart. The heart actually exists inside of this multi-layered membrane that we call the pericardium. We'll talk about that a little bit later on. But the heart is within this pericardium, this multi-layered membrane. And also you can see that the heart lies on a slight left angle. You can see the point, also known as the apex of the heart, is orientated so that it points slightly to the left. That will become relevant a little bit later on as well. So before we move on any further, I want to make sure, besides knowing where the heart is located in the body, we also know some basic definitions. What's the difference between an artery and a vein? Okay. These are both blood vessels, arteries and veins. The difference between an artery and a vein is 100% always this. Arteries take blood away from the heart, and veins take blood to the heart. Okay, so if this is the heart right here, an artery always takes blood away from the heart. A vein always takes blood back to the heart. This is true 100% of the time. Whether the blood is what's called oxygenated or deoxygenated makes absolutely no difference. Okay? That's what throws people off. They oftentimes think arteries carry oxygenated blood and veins carry deoxygenated blood, which is true as you're going to see in the systemic circuit, but it's reversed in the pulmonary circuit. So trying to factor what type of blood is within a vessel is absolutely meaningless to the vessel's definition. If the vessel takes blood away from the heart, it's called an artery. If a vessel takes blood to the heart, it's called a vein. That is always how the definition works. All right, next, we're going to take a look at the difference between the right and the left side of the heart generally, and what's called the pulmonary and systemic circuit. So this is the right side of the heart. What we know about the right side of the heart is the right side of the heart always is going to do this. It's going to pump what's called deoxygenated blood. We'll get to all those definitions in a moment, but it's going to pump what's called deoxygenated blood to what's called the pulmonary circuit. That's what the right side of the heart does. The right side of the heart, pumps blood, which is deoxygenated. That means it's poor in oxygen, rich in carbon dioxide. It takes this blood and it pumps it to the pulmonary circuit. So what's the pulmonary circuit? The pulmonary circuit are all the blood vessels that take blood to and from the lungs. That's what the pulmonary circuit is. The vessels that take blood to and from the lungs are referred to as the pulmonary circuit. It's the pulmonary circuit of blood vessels. The right side of the heart pumps blood, deoxygenated blood, to the pulmonary circuit. Okay? And then you might say, well, what's the function of the pulmonary circuit? The function of the pulmonary circuit is really twofold. The pulmonary circuit, first of all, takes blood to the lungs, where the blood can get oxygenated, meaning that the blood can gain fresh oxygen and lose carbon dioxide. That's what's going to happen at the lungs. So the pulmonary circuit will, first of all, take the blood, which we know is deoxygenated, to the lungs. And then at the lungs, the blood will become oxygenated. It will lose the carbon dioxide that it has, some of it at least, and it will gain oxygen. That's what the oxygenation process is. Blood that's taken to the lungs gets oxygenated. It loses carbon dioxide and it gains oxygen. Okay, so now the blood has been oxygenated. And then the second thing that the pulmonary circuit is going to do is it's going to take now what's called oxygenated blood, right? Blood that's rich in oxygen, poor in carbon dioxide, because what just happened to the blood at the lungs? It got oxygenated. Okay, so now the blood, which is oxygenated, is going to be carried by the pulmonary circuit back to what's called the left side of the heart. So if you really define the function of the pulmonary circuit, what's the job of the pulmonary circuit? Well, let's even take a step further back. What is the pulmonary circuit? The pulmonary circuit are all the blood vessels that take blood to and from the lungs. That's like the anatomical definition of the pulmonary circuit. The vessels that take blood to and from the lungs. What's the function of the pulmonary circuit? The function of the pulmonary circuit is to take blood to the lungs so that it can get oxygenated and then return the oxygenated blood to the heart, specifically the left side of the heart. And I know I said this already, but what pumps blood to the pulmonary circuit? The right side of the heart. So we associate the right side of the heart with the pulmonary circuit because the right side of the heart pumps blood to the pulmonary circuit. Okay, so that's where these definitions ultimately all come from. All right, so now let's do the same thing with the left side of the heart. What is the left side of the heart associated with? What circuit is it associated with? And what's the job of that circuit? So what about the left side of the heart? First of all, the left side of the heart is going to receive blood, specifically oxygenated blood, from the pulmonary circuit. Now, how could that be? The pulmonary circuit, right, first of all, has blood pumped into it by the right side of the heart, and this blood is deoxygenated. And then what the pulmonary circuit does is it takes blood to and from the lungs. Specifically, the pulmonary circuit takes blood, which is deoxygenated, to the lungs. And then the blood gets oxygenated at the lungs. And then what the pulmonary circuit does is it takes this now oxygenated blood from the lungs, right, away from the lungs, and it brings that oxygenated blood to the left side of the heart. That's what's being depicted, right, in this image. Deoxygenated blood is being carried from the right side of the heart, through the pulmonary circuit. Right? And the pulmonary circuit is taking this deoxygenated blood from the right side of the heart to the lungs. Then the blood gets oxygenated, and then the pulmonary circuit is taking this now oxygenated blood away from the lungs to the left side of the heart. So what we say about the left side of the heart is that it receives oxygenated blood from the pulmonary circuit. Right? When we say that the pulmonary circuit takes blood to and from the lungs, we mean that it's taking blood, deoxygenated blood, to the lungs. Then it gets oxygenated and it carries the oxygenated blood away from the lungs. But where does it carry that oxygenated blood away from the lungs towards? Well, it carries that oxygenated blood away from the lungs to the left side of the heart. All right, so that's where that comes from. The left side of the heart receives oxygenated blood from the pulmonary circuit. And then what the left side of the heart does is it pumps the blood into what's called the systemic circuit. The left side of the heart is going to pump this oxygenated blood that it received from the pulmonary circuit into the systemic circuit. So we better define the systemic circuit first of all. The systemic circuit is the collection of blood vessels throughout the body. It's the vast majority of vessels that everybody thinks about. Okay? The systemic circuit takes blood to and from all of the different tissues of the body, right? So here is a collection of tissues. What you're seeing is that the systemic circuit carries blood to and then from all of the different tissues of the human body. What are the different tissues? This could be nervous tissue, this could be muscle tissue, this could be connective tissue. I know it doesn't carry blood really directly to epithelial tissue, but it carries it next to it, right? The systemic circuit carries blood to and from all of the different tissues of the human body. That's what's trying to be, that's what the image, excuse me, is trying to depict. All right, so you say the left side of the heart takes this oxygenated blood that it received from the pulmonary circuit, and it pumps this oxygenated blood into the systemic circuit. And then how do we define the systemic circuit? The systemic circuit are all the vessels in the human body that take blood to and then from our tissues. Okay, that's what's being depicted here. So there is the definitional component of the systemic circuit, the vessels that take blood to and from the different tissues of the human body. But what's the function of the systemic circuit? Well, the function of the systemic circuit is to take oxygenated blood to the tissues, right? Because what gets pumped into the systemic circuit? What gets pumped into the systemic circuit is oxygenated blood from the left side of the heart. So what the systemic circuit does is it takes this oxygenated blood to the tissues, and then the blood becomes what's called deoxygenated. Basically, the oxygen that's within the blood goes into the tissues because the tissues, the cells of those tissues, need the oxygen to make ATP through oxidative phosphorylation. At the same time, those cells within those tissues are producing carbon dioxide, which is a waste product of, ultimately ATP production through aerobic means. And then that carbon dioxide, which is a waste product, goes into the blood. So the systemic circuit takes this oxygenated blood to the tissues. And then at the level of the tissues, what happens is ultimately the blood becomes deoxygenated. The oxygen that's within the blood goes into the tissues, and the carbon dioxide, which is a waste product being produced by the tissues, the cells of the tissues, goes into the blood. So as this oxygenated blood is carried by the systemic circuit to the tissues, it becomes deoxygenated. And then the next thing that the systemic circuit needs to do is it needs to carry this deoxygenated blood away from the tissues, And it carries that deoxygenated blood away from the tissues back to the right side of the heart. So the function of the systemic circuit is to take oxygenated blood to the tissues of the body, right? The systemic circuit carries this oxygenated blood to the tissues of the body, where the blood then becomes deoxygenated. And then the systemic circuit takes that deoxygenated blood away from the tissues and brings it back to the right side of the heart. So now we can actually finally finish the loop. The right side of the heart receives this deoxygenated blood from the systemic circuit. And then what does the right side of the heart do? The right side of the heart pumps this deoxygenated blood that it received from the systemic circuit into the pulmonary circuit. And then what does the pulmonary circuit do? It brings blood to and from the lungs. More specifically, the pulmonary circuit takes deoxygenated blood that it receives from the right side of the heart, brings it to the lungs. Ultimately the blood, the deoxygenated blood in the pulmonary circuit being brought to the lungs becomes oxygenated at the lungs. And then the pulmonary circuit takes the oxygenated blood away or from the lungs back to the left side of the heart. And then what does the left side of the heart do? The left side of the heart pumps blood into the systemic circuit. And then the systemic circuit takes this oxygenated blood to and from the tissues where it can become deoxygenated. So this is an endless loop, ultimately, of how blood gets oxygenated at the lungs and then deoxygenated at the tissues. And the heart is responsible for keeping this loop going endlessly. So this is why we associate the right side of the heart with the pulmonary circuit and the left side of the heart with the systemic circuit. If all of this didn't make perfect sense to you, it's perfectly fine, because we're actually going to spend, the next multiple lectures trying to explain all of this, because the next thing that we're going to do is we're actually going to take a look at the path that blood takes through the heart. Then we're going to talk about the function of the heart. Really kind of its physiology, of the heart. We're going to look at how the heart is able to generate its own action potentials and contract. And then we're going to take a look in coming chapters at how blood is transported through vessels and then how the lungs work. So this is really just a very basic introduction to all the things that we're going to be discussing in all of the coming lectures. So what we're going to do now is we're actually going to look at the way that blood travels through the heart. In order to do that, we need to take a look at the way that blood comes into and also leaves the heart. And to be able to do that, we need to define and realize that the systemic and pulmonary circuit are made up of arteries and veins. We defined arteries and veins earlier on. Arteries always take blood away from the heart. Veins always take blood back to the heart. All right. So we're going to start off with blood coming back to or coming towards the right side of the heart. If there are vessels taking blood towards the right side of the heart, then those vessels must be called veins. That has to be true, because any vessel that takes blood towards the heart is called a vein. Two of the biggest and most major veins of the systemic circuit are the superior and inferior vena cava. The superior and inferior vena cava are two major veins, and veins by definition take blood towards the heart. Two major veins of the systemic circuit that take blood back to the right side of the heart. It just so happens that these veins have deoxygenated blood within them, right? Because what does the systemic circuit do? The systemic circuit returns deoxygenated blood to the right side of the heart. We know this, hopefully. In the systemic circuit, generally speaking, veins have deoxygenated blood in them. But that's not what defines a vein. What defines a vein, and you're going to see why this is so important in a little bit here, what defines a vein is just the simple fact that they take blood towards the heart. So here is the superior and inferior vena cava carrying blood from the systemic circuit back towards the heart. That's why we call the superior and inferior vena cava veins, because they carry blood back towards the heart. Now, they're part of the systemic circuit, and it happens to be that there is deoxygenated blood within the superior and inferior vena cava, and they're dropping this deoxygenated blood off into the right side of the heart. And they both drop this blood off into the upper right chamber of the heart called the right atrium. The right atrium is the upper right chamber of the heart, and it receives deoxygenated blood from the superior and inferior vena cava, these major veins of the systemic circuit. And then what will happen is, why don't we, just for fun, do it in blue. This deoxygenated blood will build up in the right atrium, this upper right chamber of the heart, as more and more deoxygenated blood is dumped into it by the superior and inferior vena cava, these veins from the systemic circuit. And the right atrium, the upper right chamber, is separated from the right ventricle, the right lower chamber, by a valve, which is oftentimes referred to as the tricuspid valve. Okay? This valve is going to be closed to start off with, right? So because the upper right chamber and lower right chamber, upper right chamber being called the right atrium, lower right chamber being called the right ventricle, because these two chambers are separated from each other by this tricuspid valve, the deoxygenated blood builds up in the right atrium. And as it builds up, pressure builds in the right atrium, and that pressure ultimately causes the tricuspid valve to open. And when the tricuspid valve opens, it creates a pathway for this deoxygenated blood within the right atrium to flow into the right ventricle. Okay? So what I'm saying is, deoxygenated blood builds up in the right atrium. That causes pressure to build in the right atrium. That pressure causes this tricuspid valve to open up. And that then, if the tricuspid valve opens, that allows the deoxygenated blood within the right atrium to flow into the right ventricle. About 80% of the blood flows from the right atrium into the right ventricle through pressure gradients. And then the remaining 20% is pushed from the right atrium into the right ventricle due to the right atrium actually contracting. So the right atrium will contract and it will push the remaining 20% of the blood from the right atrium into the right ventricle. And now we've got all of this blood, all of this deoxygenated blood in the right ventricle. Okay? And what's going to happen next is the right ventricle is going to contract. And when the right ventricle contracts, what it does is it just generally pushes blood upward. Okay? There's a whole bunch of blood in the right ventricle, the lower right chamber, and then the lower right chamber, the right ventricle contracts. Right? Because I know I haven't said this explicitly, but the heart is made up of muscle. It's made up of what's called cardiac muscle, which is very similar to skeletal muscle, as you're going to see. And it can contract just like skeletal muscle. So the right ventricle is going to contract, and it's just generally going to push this blood upwards. And when the blood gets pushed upwards, you would think that the blood could easily travel from the right ventricle right back up into the right atrium, and that can absolutely happen. But in a healthy person, in a healthy heart, that doesn't happen, because normally when the right ventricle contracts and it pushes the blood upward, that movement of the blood upward actually causes the tricuspid valve to shut. Right? The movement of the valve, first of all, is anatomically orientated so that when the blood is pushed upward, the pushing of the blood upward actually causes the valve to close. And the valve closes, and that actually prevents the blood from being able to flow from the right ventricle back up into the right atrium. That's very important, right? Because you need to make sure that the blood doesn't flow from the right ventricle back up into the right atrium. That's not what you want. You want the blood to travel from the right ventricle out into what's called the pulmonary trunk. And the way that it gets out into the pulmonary trunk is it travels through this thing called the pulmonary semilunar valve. Okay? So here's what's going to happen. The right ventricle is going to contract, and when the right ventricle contracts, blood within the right ventricle, this deoxygenated blood, gets just pushed upward generally. The blood getting pushed upward causes the tricuspid valve to close. That prevents the blood from flowing from the right ventricle back up into the right atrium and ensures that the blood only goes in one direction, which is through the pulmonary semilunar valve into the pulmonary trunk. So blood flows from the right ventricle through the pulmonary semilunar valve into the pulmonary trunk. Now there's something else here that's quite important to say, which is this tricuspid valve, when it closes, it could very easily prolapse. By that I mean the tricuspid valve could easily actually prolapse into the right atrium. And if it were to do that, if it were to prolapse into the right atrium, that would actually allow the blood from the right ventricle to travel into the right atrium. Okay. Basically, what I'm saying is the force that the blood generates, when the right ventricle contracts, the blood within the right ventricle generates a lot of force, a lot of pressure, and it pushes on the tricuspid valve, so forcefully that it can actually quite easily cause the tricuspid valve to prolapse into the right atrium. And if that were to happen, then the blood would flow from actually the right ventricle back up into the right atrium. And that's not the direction that we want the blood to go. So what prevents the tricuspid valve from prolapsing? And the answer is, if you look in the right ventricle, there are these little muscles, and they're called papillary muscles. Okay, the name's right there. They're called papillary muscles. And what's attached to the papillary muscles are these little stringy tendon-looking structures called chordae tendineae. The chordae tendineae are attached to the papillary muscles, and they run up and they attach to the tricuspid valve. Okay? So this is what occurs. When the right ventricle contracts, the papillary muscles, for all intents and purposes, are really part of the right ventricle. So when the right ventricle contracts, so do the papillary muscles. And when the papillary muscles contract, what the papillary muscles do is they actually pull on the chordae tendineae. And the chordae tendineae is attached to the tricuspid valve. And if the papillary muscles contract and pull on the chordae tendineae, and the chordae tendineae are attached to the tricuspid valve, then ultimately what this results in is the papillary muscles, in essence, pull on the tricuspid valve, right, through exerting force onto the chordae tendineae, which are attached to the tricuspid valve. And this is what prevents the tricuspid valve from prolapsing. Okay? Imagine the chordae tendineae like parachute strings. Okay? It's kind of like that. The parachute strings actually tug on the parachute, and it prevents the parachute, if someone's parachuting, the parachute strings prevent the parachute from prolapsing. I mean, from turning in on itself. If there were no parachute strings there, the parachute would easily turn in on itself, and it would serve absolutely no purpose because the person would just fall with gravity. Okay? What the chordae tendineae do, right, and more, what really happens here, let's say, is when the right ventricle contracts, okay, when the right ventricle contracts, blood within the right ventricle gets pushed upward. And when that blood gets pushed upward, it causes the tricuspid valve to close. But that force that the blood exerts on the tricuspid valve could easily cause it to prolapse into the right atrium, and then blood could flow from the right ventricle into the right atrium. But that doesn't happen in a healthy heart. And here's why. Because when the tricuspid valve, when the right ventricle contracts, so do the papillary muscles. So when the right ventricle contracts, the papillary muscles contract. And when the papillary muscles contract, they tug on the chordae tendineae. And thus, if the papillary muscles contract and tug on the chordae tendineae, then the chordae tendineae tugs on the tricuspid valve, which is what the chordae tendineae is attached to. And that ensures that the tricuspid valve stays closed, right? The papillary muscles essentially apply force to the tricuspid valve by pulling on the chordae tendineae, which the tricuspid valve is attached to. And that ensures that the tricuspid valve stays closed and that the tricuspid valve can actually withstand the pressure that the blood is exerting against it. The papillary muscles, what they do is they prevent the tricuspid valve from prolapsing into the right atrium, because the papillary muscles basically pull through the chordae tendineae on the tricuspid valve and keep the tricuspid valve closed. And that prevents the tricuspid valve from prolapsing into the right atrium and keeps it shut. And that ensures that the blood can only flow from the right ventricle through the pulmonary semilunar valve out into the pulmonary trunk. You're going to see this exact same process play out on the left side of the heart in a little bit. So what we've accomplished here is we have moved deoxygenated blood from the right ventricle through the pulmonary semilunar valve into the pulmonary trunk. And now, once we get into the pulmonary trunk, we've actually entered into the beginning of the pulmonary circuit, because these are the blood vessels that are going to take blood to and from the lungs. Okay? How do we know that? Well, it's called the pulmonary trunk. And what the pulmonary trunk is going to turn into, it's going to branch into what are called left and right pulmonary arteries. Okay? Pulmonary arteries. Why are these called pulmonary arteries? Don't get confused by this, and this is why I've been harping on this since the beginning. What's an artery? An artery is a blood vessel that takes blood away from the heart. That's all it means 100% of the time. These are clearly blood vessels, right, that are taking blood away from the heart. So these must be defined as arteries. The left and right pulmonary arteries are taking blood away from the heart. But what type of blood is this? This blood is deoxygenated, because what's in the right side of the heart? Right? Deoxygenated blood flows from the superior and inferior vena cava into the right atrium, down into the right ventricle, and then from the right ventricle, the deoxygenated blood moves into the pulmonary trunk and the pulmonary arteries. So this is deoxygenated blood that actually exists in the left and right pulmonary arteries. The pulmonary arteries carry deoxygenated blood. The type of blood in a vessel is meaningless to its definition. Okay? That is a huge thing to remember that so many people get mixed up. Okay? What type of blood in a vessel, what type of blood is in a vessel, just it means nothing. Okay? The pulmonary arteries are called arteries because they're taking this blood away from the heart, and it happens to be deoxygenated. And it has to be, right? Because it's coming from the right side of the heart. And now what's going to happen? The pulmonary arteries are going to take blood to the lungs. The pulmonary arteries are going to take this ultimately deoxygenated blood to the lungs. And then what's going to happen at the lungs? The lungs are going to oxygenate the blood. And then what's going to happen? The pulmonary circuit is going to now take this oxygenated blood back to the heart. So what are the vessels that must take blood back to the heart? If these are the lungs, these are the vessels that are going to take the blood back towards the heart. They are called pulmonary veins, right? Left and right pulmonary veins. Why would we call these veins? We'd call them veins because by definition, a vein just takes blood back towards the heart. That's all the definition of a vein is. But what type of blood is within the left and right pulmonary veins? Well, the type of blood that exists in the left and right pulmonary veins is oxygenated, right? Because it's blood that's coming from the heart that just got oxygenated. So the left and right pulmonary veins carry oxygenated blood back towards the left side of the heart. Specifically, the left and right pulmonary veins are going to carry oxygenated blood. I think you know this, right? Because the pulmonary circuit takes blood back to the left side of the heart. But specifically, the left and right pulmonary veins are going to take oxygenated blood back to the upper left chamber, which we call the left atrium. The left and right pulmonary veins carry oxygenated blood back to the left side of the heart and dump it into the left atrium, the upper left chamber of the heart. Let's make sure that you're actually seeing what I want you to, because I think this all can be very confusing, especially if you've never taken anatomy before. Okay, you've now actually seen the entire pulmonary circuit. The pulmonary circuit are all of the blood vessels that take blood to and from the lungs. Okay, and what pumps blood into the pulmonary circuit? Okay, first of all, the right side of the heart. The right ventricle pumps blood into the pulmonary circuit. The pulmonary circuit are all the blood vessels that take blood to and from the lungs. Okay, so if the pulmonary circuit is made up of all the blood vessels that take blood to and from the lungs, then the pulmonary circuit must be made up of the pulmonary trunk and the pulmonary arteries. The pulmonary trunk and the pulmonary arteries are going to be the vessels of the pulmonary circuit that take blood to the lungs, specifically deoxygenated blood. Okay? And then the blood gets oxygenated at the lungs. And then what happens? The pulmonary circuit is also made up of the blood vessels that take blood from the lungs, right, away from the lungs back towards the heart. So the pulmonary circuit is also made up of the pulmonary veins. The pulmonary veins are going to be the blood vessels of the pulmonary circuit that take this blood back towards the left side of the heart, specifically the left atrium. So the pulmonary circuit is really made up of the pulmonary trunk and pulmonary arteries, which take this deoxygenated blood away from the heart. And the pulmonary circuit is also made up of the pulmonary veins, which take the oxygenated blood from the lungs back towards the heart. After you realize what the vessels of the pulmonary circuit actually are, pulmonary trunk, pulmonary arteries, and pulmonary veins, then you can realize in the pulmonary circuit, the kind of deoxygenated, oxygenated blood thing is reversed from the systemic circuit, as you're going to see. In the pulmonary circuit, it just so happens to be that arteries, the vessels taking blood away from the heart and to the lungs, carry deoxygenated blood. And the veins, taking the blood away from the lungs and back towards the heart, by definition, a vein takes blood back towards the heart. The veins within the pulmonary circuit carry oxygenated blood. Okay, so that just happens to be the case with the pulmonary circuit. You see arteries that carry deoxygenated blood, and you see veins that carry oxygenated blood. That's what happens in the pulmonary circuit. So what is happening now? Oxygenated blood is being brought from the pulmonary circuit back to the left side of the heart. Okay? And that oxygenated blood is being brought from the pulmonary circuit by the left and right pulmonary veins. Where specifically do the left and right pulmonary veins carrying this deoxygenated blood from the pulmonary circuit drop this blood off? They drop the blood off in the upper left chamber of the heart called the left atrium. And what happens then is this oxygenated blood begins to build in the left atrium. And what we see is the kind of the same orientation on the left side as we do on the right. The left atrium is separated from the left ventricle. Like the left atrium is the upper left chamber, the left ventricle is the lower left chamber. Okay? And the left atrium and the left ventricle are separated from each other by what is known as the bicuspid or mitral valve. It is sometimes referred to as, both mean the same thing. Okay? And this bicuspid or mitral valve is what separates the left atrium from the left ventricle. And this oxygenated blood coming from the pulmonary circuit is building up in the left atrium. And as it builds, it generates pressure. And that pressure that the blood generates causes the mitral or bicuspid valve to open up. Right? The same exact thing happened on the right side. And ultimately, that bicuspid valve, due to this pressure, will open up, and this oxygenated blood will begin to flow from the left atrium into the left ventricle. And about 80% of the blood will travel that way. And the remaining about 20% will travel from the left atrium into the left ventricle because of the fact that the left atrium will contract. The left atrium will contract, and it will push the blood, the remaining 20% of the oxygenated blood, from the left atrium into the left ventricle. And now we've got all of this oxygenated blood hanging out in the left ventricle. So what happens to this blood that's hanging out in the left ventricle? Well, what's going to occur is the left ventricle now is going to contract, just like the right ventricle can contract. The left ventricle is going to contract, and what's going to occur? The blood is going to get forced upward. And what do you think happens, right? This is just like the right side. As the left ventricle contracts and the blood gets forced upward, that causes the bicuspid or mitral valve to close. Now, easily enough pressure can be generated by the blood to cause the mitral or bicuspid valve to prolapse, and that would allow then for the blood in the left ventricle to travel into the left atrium. But that doesn't happen, right? Because there's papillary muscles on the left side. These papillary muscles contract when the left ventricle contracts. And when the papillary muscles contract, they tug on the chordae tendineae, which are attached to the bicuspid or mitral valve. And since the papillary muscles contract and tug on the chordae tendineae, and thus tug on the bicuspid or mitral valve, that prevents the bicuspid or mitral valve from prolapsing. It keeps the bicuspid or mitral valve closed, right? The papillary muscles contracting and tugging on the chordae tendineae and then thus tugging on the bicuspid or mitral valve ensures that force is applied to the mitral valve or bicuspid valve, and that ensures that it can withstand the pressure that the blood is exerting against it, and it won't prolapse, right? The contraction of the papillary muscles ultimately prevents the bicuspid or mitral valve from prolapsing. It keeps it closed. It enables this valve to deal with the pressure that the blood is exerting against it, and it keeps it shut. Okay? And that ensures that the blood from the left ventricle only goes in one direction. The blood from the left ventricle is going to travel through what we call the aortic semilunar valve and out into the aorta. And now you have to think, what have we just witnessed here? We have witnessed the left side of the heart receive oxygenated blood, first of all, from the pulmonary circuit. Right? The pulmonary circuit brings oxygenated blood to the left side of the heart. And then what does the left side of the heart do with that oxygenated blood? It pumps it out into the systemic circuit. And what's the beginning of the systemic circuit? The aorta. The aorta is the beginning of the systemic circuit, just like the pulmonary trunk is the beginning of the pulmonary circuit. So what is the systemic circuit, if we define it again? The systemic circuit are all of the blood vessels that take blood to and from the tissues of our body. What I can tell you is the aorta is going to branch into every single systemic vessel that we know of, right? The aorta ultimately branches hundreds of times, and then those will all branch as well, like a tree, and those become named vessels too. So the aorta branches into really every systemic vessel that we know of. Specifically, the aorta is going to branch into every systemic artery that we know of in the human body. The aorta is going to branch into ultimately into every single artery in the human body, with the exception of the pulmonary arteries. Okay, so every named artery in the human body, with the exception of the pulmonary arteries, the vessels taking blood, to the lungs, every single named artery in the human body, with the exception of those pulmonary arteries, is a branch of the aorta. And all of those systemic arteries that are branches of the aorta are going to carry this oxygenated blood away from the heart and towards the tissues of the body. And then what's going to happen is, as the systemic arteries formed from the aorta, branches of the aorta, go to specific tissues of the body, what's going to happen is the oxygenated blood within those arteries is going to become deoxygenated, right? So let's say, here is a systemic artery, right? It's going to go past some tissues. Okay. This systemic artery is carrying oxygenated blood. It's going to go past these tissues, and then the blood is going to become deoxygenated. And then what's going to happen? Right? There's going to be a systemic vein. Now we're going to call it a vein because it's going to be carrying blood back towards the heart. Right? And there's going to be a systemic vein that's going to carry now deoxygenated blood back towards the heart. Why do we call it a vein? Well, we call it a vein because it's carrying blood back towards the heart. Specifically, where is this vein going to be headed towards? Ultimately, the vein is going to merge, depending upon whether it's in the upper or lower extremity. This vein is going to merge somewhere along the line with something that becomes either the superior or inferior vena cava. Ultimately, every vein in the systemic circuit somewhere along the line merges with another vein that ultimately becomes either the superior or inferior vena cava. There are some exceptions to that rule with ultimately the coronary veins, but there's very few examples of that. Okay? More or less, every systemic vein, right, a vessel that's part of the systemic circuit taking blood back towards the heart, is going to merge somewhere along the line and become either the superior or inferior vena cava. And then that deoxygenated blood from either the superior or inferior vena cava is going to get dumped back into the right atrium. So here you can see, right, we can erase this for a second. You can really see how the left side of the heart is associated with the systemic circuit. The left side of the heart, the left ventricle, is going to contract and pump blood out into the aorta. The aorta is the beginning of the systemic circuit. The systemic circuit is all the blood vessels in the human body that take blood to and from the different tissues of the body. Again, all the different tissues of the human body. The aorta is where the systemic circuit starts. The aorta is going to branch into every systemic, ultimately, vessel that we know of. Specifically, to start off with, we're talking about the systemic arteries. The aorta is going to branch into every systemic artery, right? All the vessels taking blood away from the heart towards tissues. And all of these systemic arteries are going to be carrying oxygenated blood towards these tissues. Right here we can see we're carrying oxygenated blood towards the tissues. And the oxygenated blood gets brought to the tissues Then the blood becomes deoxygenated because the oxygen goes into the tissues. And now we need the systemic veins, right? Vessels carrying blood back towards the heart. We need the systemic veins to carry the deoxygenated blood, or it could be down here, right? To carry the deoxygenated blood ultimately back towards the right side of the heart, towards the right atrium. So that is the systemic circuit. The systemic circuit is made up of all the blood vessels, arteries, and veins that take blood to and from our tissues. And it just so happens to be, and this is why everybody gets this mixed up, in the systemic circuit, arteries, the vessels that carry blood away from the heart, that are branches ultimately of the aorta, the arteries carry oxygenated blood. And the veins, the vessels that take blood back towards the heart, most of which form and merge either with the superior or inferior vena cava, the veins carry deoxygenated blood. But again, that flip-flops in the pulmonary circuit. And then I hope you can see how the cycle repeats, right? Because the systemic veins carrying deoxygenated blood, the systemic veins carrying deoxygenated blood are going to bring the blood back to the right side of the heart. And then the right side of the heart is going to push the blood out into the pulmonary circuit. And the pulmonary circuit is going to take blood to and from the lungs where it will be oxygenated, right? And ultimately bring that blood back to the left side of the heart, which will pump the blood back out into the systemic circuit once again. It is a constant cycle of oxygenating the blood at the lungs and deoxygenating the blood at the tissues. So now that we've talked about the flow of blood through the heart, we can make sense of what are called heart sounds. If you take a stethoscope and you put that stethoscope up to somebody's heart, you can put it up to your own heart, in fact, and you were to listen, you would hear at least two very distinct sounds. There's technically more than that, but that's a much more advanced conversation. The two sounds that you would hear, and this varies from one text to the next exactly how you spell the sound, but the two distinct sounds that you typically hear are Lub-Dub. Some people will say Lup-Dub. We'll go with Lub-Dub. Lub-Dub. So where are these sounds coming from? Because this is about what you would hear. You take the stethoscope, you'd put it up to somebody's heart, and you would just keep hearing Lub-Dub, Lub-Dub, Lub-Dub. You could, again, go get a stethoscope and give this a try. Put it up to your heart, and you'll hear a Lub-Dub, Lub-Dub, Lub-Dub. Like, it'll just keep repeating over and over and over and over and over again. And maybe you'll interpret it as being Lup-Dub. I don't know. It doesn't matter, ultimately. Where are these Lub-Dub sounds coming from that you're hearing when you have a stethoscope up to yours or somebody else's heart? So to understand where the heart sounds come from, you have to understand something that's very important. I don't explicitly say this in the first part of the lecture because it would be far too confusing to mention this right off the bat, but now it should make sense. The left and right atrium actually contract at the exact same time. Okay? They contract simultaneously. All of the muscle of the left and right atrium, as you're about to see, is continuous. Okay? So it's not like the right atrium contracts and then the left atrium contracts. That's not how it works. The left and right atrium actually contract at the exact same time. And what that means is that the blood from the left and the right atrium gets pumped down into the left and right ventricle simultaneously. So that's kind of the important fact number one, realizing that the left and right atrium actually contract at the same time, and that pushes blood from both the left and right atrium down into the left and right ventricle at the same time. And then after the left and right atrium are done contracting, what happens is the left and right ventricle contract. Okay? It's not like the right ventricle contracts and then the left ventricle contracts. As you're going to see, the right and left ventricle, it's all continuous muscle. So the left and right ventricle actually contract at the exact same time. And what that means is if the left and right ventricle both contract simultaneously, then at the same time, blood moves from the right ventricle out into the pulmonary trunk at the same time that blood is moving from the left ventricle out into the aorta, right? This is happening simultaneously, okay? The whole left and right ventricle contracts at the same time, pushing blood from the right ventricle out into the pulmonary trunk and from the left ventricle out into the aorta at the exact same point in time. If you really get into the weeds and technicalities of this, they might be a couple milliseconds off, but to the eye, the whole ventricle, the left and right ventricle, contracts at the exact same time. The way that this actually works in the heart, as we're going to spend an entire lecture discussing, is first the left and right atrium are going to contract, pushing blood down into the left and right ventricle, and then after a very short delay, the left and right ventricle contract at the same time, pushing blood out into the pulmonary trunk and out into the aorta. Once you understand that the left and right atrium contract simultaneously, and then after a short pause, the left and right ventricle contract simultaneously, you can understand heart sounds. Okay? So you put the stethoscope up to somebody's heart, your heart, somebody else's heart, and you just keep hearing lub-dub, lub-dub, lub-dub. And you say, okay, first of all, where is the lub, the first sound, coming from? Where's lub coming from? Lub, first of all, this isn't where the sound comes from, but we have to start from somewhere. Lub is coming, first of all, the left and right ventricle are contracting, right? The left and right ventricle contract simultaneously. Okay? That's not where the sound comes from. But when the left and right ventricle contract, what happens? The blood gets pushed from the left and right ventricle upward. And as the blood gets pushed from the left and right ventricle upward, right, what happens? In the left ventricle, the blood gets pushed upward, and that causes the bicuspid or mitral valve to shut. In the right ventricle, the blood gets pushed upward, and that causes the tricuspid valve to shut. That's what's actually being depicted over in this image, right? Blood is being pushed upward. This is specific to the right side, but it's also happening on the left. Blood is getting pushed upward in the right ventricle in this image, and the movement of the blood upward, and thus the pressure that it's generating, the force that it's generating, it's causing the tricuspid valve to close. And over on the left side, the bicuspid or mitral valve would be closing. And of course, we know, again, that what's also being depicted in the image is the papillary muscles contracting, pulling on the chordae tendineae, and making sure that the tricuspid valve doesn't prolapse. The same thing would be happening with the bicuspid or mitral valve. Anyways, where does the sound actually come from? The lub sound comes from the tricuspid and bicuspid valve closing. That's where the sound comes from. When the blood gets propelled upward and causes the bicuspid or mitral valve on the left side to close and the tricuspid valve on the right side to close, that is what creates this lub noise. It's closing of the bicuspid and tricuspid valve. Right? That's where the sound comes from. We do not say that the sound comes from the contraction of the left and right ventricle. That's not where the sound comes from. You're not hearing the left and right ventricle contract. What you're hearing when you put a stethoscope up to somebody's heart and you hear that lub sound, you're hearing their tricuspid and bicuspid valve closing, right? Because of the fact that the left and right ventricle are contracting and pushing the blood upward, and that's causing the tricuspid and the bicuspid valve to close. You know, you're hearing the valves closing, but you're not actually hearing contraction of the muscle. That's not what you're hearing. Now, after that lub sound, you'll hear a dub sound. You'll hear lub-dub, 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 lub-dub. Where is the dub sound coming from? Okay. You'll hear lub first, which is the closing of the tricuspid and the bicuspid valve, and then you'll hear the dub sound. Where's the dub sound coming from? Okay, so after the left and right ventricle contract, the blood gets pushed from the right ventricle out into the pulmonary trunk and from the left ventricle out into the aorta. But after the contraction is over, what will happen is the blood will begin to flow backwards. Right after the left and right ventricle finish contracting, and that causes all this blood pressure to occur. Right, the blood generates a lot of pressure, force. We'll talk about what all those terms mean shortly. After the left and right ventricle are finished contracting, and there's not all this force or pressure being generated anymore, the blood will actually begin to flow backwards from the aorta back towards the left ventricle and from the pulmonary trunk back towards the right ventricle. So this is an image of the aortic semilunar valve. You just have to know that the pulmonary semilunar valve looks very, very similar. Okay, so first what happens is when the left ventricle contracts, the contraction of the left ventricle pushes blood through the aortic semilunar valve up into the aorta. Then when contraction is over and there's a significant reduction in the pressure or force that the blood is exerting, it begins to move backwards. Right? The blood will actually begin to flow backwards. It will flow backwards from the aorta towards the left ventricle. So it will be flowing from the aorta back towards the left ventricle. And the aortic semilunar valve in this example, and this is true for the pulmonary semilunar valve too, is shaped in a way that when the blood begins to flow backwards, it actually causes the aortic semilunar valve to close. Okay, and you can see that being depicted in the image as the blood is flowing backwards from the aorta towards the left ventricle, and as the blood is moving backwards, the movement of that blood from the aorta back towards the left ventricle actually causes the aortic semilunar valve to close and catch the blood, and that actually then prevents the blood from moving from the aorta backwards into the left ventricle, which of course is exactly what you would want. You wouldn't want the blood flowing from the aorta back towards the left ventricle, right? That would be terrible. It would cause ultimately congestive heart failure. So this doesn't just happen on the left side, right? It happens on the right side too. So here we can look at it collectively. When the left and right ventricle contract, blood is going to move from the left ventricle through the aortic semilunar valve up into the aorta, and blood is going to move from the right ventricle through the pulmonary semilunar valve into the pulmonary trunk. Now, after contraction of the left and right ventricle, the blood is going to begin to flow backwards from the aorta towards the left ventricle, and that's going to cause the aortic semilunar valve to shut. And the blood is also going to begin to flow backwards from the pulmonary trunk towards the right ventricle, and that's going to cause the pulmonary semilunar valve to close. And here's the thing. When the aortic and pulmonary semilunar valve close, that creates the dub sound. The closing of ultimately the aortic and pulmonary semilunar valve is what causes the second heart sound, the dub sound. And now you can figure the whole thing out, right? You take a stethoscope, you put it up to somebody's heart, and you keep hearing lub-dub, 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 right? Lub-dub. And you say, well, where does the lub and the dub sound come from? Well, the first sound that you're hearing, the lub sound, is coming from the tricuspid and bicuspid valve closing. Right? And why are the tricuspid and bicuspid valve closing? Well, because the left and right ventricle are contracting and it's pushing the blood in the right and the left ventricle upward. And when the blood in the right and left ventricle is pushed upward, it causes the tricuspid and bicuspid valve to close. But please know the actual sound that you're hearing is coming from the closure of the tricuspid and the bicuspid valve. It's not coming from the contraction of the ventricles. You're not hearing the ventricles contract. You're hearing the tricuspid and bicuspid valve closing. It's true that you wouldn't hear those two sounds if it weren't for the ventricles contracting, but the sound that you're hearing is not the ventricles contracting, it's the tricuspid and bicuspid valve closing. So we know that the lub sound comes from the closure of the tricuspid and the bicuspid valve. That is what creates the lub sound. But what creates the dub sound, right? The second heart sound. And the answer to that is, well, when the right and the left ventricle contract, where does the blood go? Where does the blood go? Blood is going to go, when the right and left ventricle contract, blood is going to go from the right ventricle through the pulmonary semilunar valve into the pulmonary trunk. And blood is going to go from the left ventricle through the aortic semilunar valve into the aorta. All right. Then, when the ventricles relax, right, when the right and left ventricle relax, that's going to happen simultaneously, the blood is going to begin to flow backwards. Blood is going to begin to move from the pulmonary trunk back towards the right ventricle. Blood is going to move from the aorta back towards the left ventricle. And when this happens, it's going to cause the semilunar valves to close. Right? As blood moves from the pulmonary trunk back towards the right ventricle, that causes, first of all, the pulmonary semilunar valve to close. And when blood flows from the aorta back towards the left ventricle, that causes the aortic semilunar valve to close. Okay? So when these two valves close, the pulmonary semilunar valve and aortic semilunar valve, that is when you hear the dub sound. And just to be clear, when you hear the dub sound, you're not hearing the right and left ventricle relax. Right? I think sometimes that gets misinterpreted. The dub sound, you're not hearing the relaxation of the ventricles. What you're hearing is the closure of the pulmonary and aortic semilunar valve. It's true that the pulmonary and aortic semilunar valves wouldn't close if the ventricles didn't relax, but what you're hearing is not relaxation of the ventricles, right? What you're actually hearing is the closure of these valves. So this is how your textbook depicts the heart sounds. First, you have the atrioventricular valves, or the AV valves. The AV valves, or atrioventricular valves, are the same thing as the tricuspid and bicuspid valves. The tricuspid and bicuspid valves can also be called the atrioventricular valves. And down here, it's showing you the aortic and pulmonary semilunar valves. Okay? When the tricuspid and bicuspid valve close, right? We can also call those the atrioventricular valves. That's when you hear the first heart sound, which is the lub sound. When the aortic and pulmonary semilunar valves close, that is when you hear the second heart sound, the dub sound. Okay, so that's all that this image is showing you. It's showing you that when the tricuspid and bicuspid valve close, right, that is when you hear the lub sound. When the aortic and pulmonary semilunar valves close, right, that is when you hear the second heart sound, the dub sound. So now we're going to move into a bit of terminology and then apply it. Two terms that are very important for the heart, understanding cardiovascular physiology. The term systole and the term diastole. All systole means is a contraction of a chamber, more specifically. This can apply to any chamber. It could be right atrial systole, it could be left atrial systole, it could be right ventricular or left ventricular systole. Systole just means the contraction of a chamber. The systole that we're most often interested in is left ventricular systole. That's the one that we'll talk about the most, but please know that this term can actually apply to any of the chambers. The term systole just means contraction of a chamber. Diastole, on the other hand, means relaxation of a chamber. Any of the chambers can go through a period of diastole, and all of them do, approximately 70 times a minute at rest. So you could have right atrial diastole, you could have left atrial diastole, you could have right and left ventricular diastole. All that means is that specific chamber is relaxing. Okay, so systole and diastole. Systole means contraction of a chamber, diastole means relaxation of a chamber. And since I said this for systole, I'll say it for diastole too. The type of diastole that we're most often interested in is left ventricular diastole. So now that I've talked about the terms systole and diastole, we can talk about the terms systolic and diastolic blood pressure. They're not the same thing, but they're related to each other. Systole and systolic blood pressure are not the same thing. Diastole and diastolic blood pressure are not the same thing. However, they are definitely related to each other. So you think, how are the terms systole and systolic blood pressure and diastolic blood pressure related to one another? And to be able to explain that, first of all, you have to know what blood pressure is. Blood pressure is the amount of pressure or force that the blood exerts against the wall of a vessel. You can measure blood pressure within any vessel in the human body. We tend to do it within certain systemic arteries, but you can measure blood pressure within any vessel in the human body. No doubt about it. So, and we do, this is not something that you can do in like a typical doctor's office or medical visit, but if you have the right techniques and the right laboratory setting, you can measure the blood pressure of any vessel in the body. Anyways, so we know that blood pressure is the amount of force or pressure that the blood exerts against the wall of a vessel. Okay, so there are two different types, ultimately, of blood pressure. Okay, there's what's called systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the maximal amount of pressure or force that blood exerts against the wall of a vessel. We measure this in millimeters of mercury. Okay, so systolic blood pressure is the maximal amount of pressure or force that blood exerts against the wall of a vessel. Diastolic blood pressure is the minimum amount of pressure or force that blood exerts against the wall of a vessel. That's all the terms mean. Systolic blood pressure is the maximum amount of force that blood exerts against the wall of a vessel. Diastolic blood pressure is the minimum amount of pressure or force that blood exerts against the wall of a vessel. Now, how do these terms relate to systole and diastole? So the easiest way to do this is to talk about the type of blood pressure that everybody is familiar with. If you go to the doctor's office or a health clinic and they take your blood pressure, quote unquote, what they're actually doing is they're taking the blood pressure of some systemic artery. Typically, it's the brachial artery, right? They put a blood pressure cuff basically around your biceps muscle, and what they're doing is they're actually taking the blood pressure that exists within the brachial artery. So the usual way that we take blood pressure is we're taking the systolic and diastolic blood pressure that exists within some systemic artery. The brachial artery is, of course, a systemic artery, and that's the artery that's most commonly used, but by no means do you have to use that artery. There are other systemic arteries that get used as well. You could also, you wouldn't really be able to do it with a blood pressure cuff, but you could take the systolic and diastolic blood pressure of a vein too in the systemic circuit. But as you're going to see later on in the semester, pretty soon actually, not much would really exist. So that would be kind of pointless. What we really want to know is what is the systolic and diastolic blood pressure within the systemic circuit. So we do that by measuring a specific systemic artery and extrapolating. So within your brachial artery, let's say that this is the brachial artery, there is going to be a systolic blood pressure and a diastolic blood pressure. Okay, the systolic blood pressure is the maximal amount of force that blood exerts against the wall of the brachial artery. The diastolic blood pressure is the minimal amount of force that blood exerts against the wall of the brachial artery. And a good systolic and diastolic blood pressure for systemic arteries that we can measure is about 120 over 80 or over 70. That's pretty normal. That's a measurement that in units of millimeters of mercury. So we would say that the blood pressure within the brachial artery is 120 systolic over 80 diastolic. That means the maximum amount of force or pressure that the blood is exerting against the wall of the brachial artery is 120 millimeters of mercury, and the minimum amount of pressure or force that the blood is exerting against the wall of the brachial artery is 80 millimeters of mercury. 120 systolic, 80 diastolic. Okay, but how does that relate to systole and diastole? And the answer is, this all comes down to left ventricular systole and left ventricular diastole. Left ventricular systole, what does that actually mean? Left ventricular systole means contraction of the left ventricle. When the left ventricle contracts, left ventricular systole, that pumps blood out into the aorta and thus all of the systemic arteries. Because the aorta, as we know, branches into all of the systemic arteries that we have. Now, when the left ventricle contracts, left ventricular systole, that is when the blood is ejected out into the systemic arteries most forcefully. And that, by consequence, is when you get systolic blood pressure, right? When left ventricular systole happens, right, the left ventricle contracts, that is when the blood is going to be being ejected into the systemic arteries most forcefully, right? And that should only be obvious. So left ventricular systole is going to cause systolic blood pressure, right? Especially within these, more specifically within these systemic arteries. That is when the maximal amount of pressure or force is going to be measured within a specific systemic artery, like the brachial artery. You're going to get systolic blood pressure within the brachial artery, maximal pressure that blood exerts against the wall of the brachial artery, when left ventricular systole occurs. And that is how the two terms are actually related to each other. And hopefully the next one is fairly obvious, right? When are we going to get diastolic blood pressure within the brachial artery? Minimum amount of pressure that the blood exerts against the wall of the brachial artery. That's going to occur when left ventricular diastole happens. When the left ventricle relaxes, that is when blood is going to be being ejected out into the systemic arteries in the least forceful manner. Of course, right? I mean, if the left ventricle isn't contracting and it's relaxing, left ventricular diastole, then there's not blood being ejected out into the systemic arteries, right? And that is when the minimum amount of pressure within the systemic arteries, diastolic blood pressure, is going to be measured. Right? So that's how left ventricular diastole relates to diastolic blood pressure, minimum force or pressure that blood exerts against the wall of the vessel within the systemic circuit. Right? When left ventricular diastole happens, that is when diastolic blood pressure will be measured in our systemic arteries. So there's one more term, which is called mean arterial pressure, also known as MAP, which is incredibly important clinically. Mean arterial pressure is what's the average amount of pressure usually within a systemic artery. That's what we're usually interested in. That's why it's called mean arterial pressure. You're trying to know what the mean arterial pressure is within the systemic circuit, although you could be interested in the pulmonary circuit too, but conversation for another day. Usually when we're measuring MAP, right, we're measuring and trying to figure out the average, the mean, the average amount of pressure that exists within the systemic circuit. So we use a specific systemic artery like the brachial artery. And we figure out mean arterial pressure, average pressure within a systemic artery by taking, the average of systolic and diastolic. But the way that that's done is a little bit complicated because systole lasts for a lot less. It doesn't last as long as diastolic blood pressure does. Systolic blood pressure is a lot shorter than diastolic blood pressure. So in reality, the equation isn't quite as simple as you would expect it to be. And even that equation that's used clinically is not the actual real way that we would, in a clinical setting, basically what you would do is you take systolic plus diastolic twice, because diastolic lasts twice as long as systolic, and then you divide it by 3. You'd get an average, and that would tell you mean arterial pressure. But what I'm saying is that's just a quick way of calculating it. It's not the real way to truly know what mean arterial pressure is, because the real way to measure mean arterial pressure, you would need incredibly advanced techniques that can't be employed in a basic clinical setting. You really need an advanced lab to be able to do that. All that is coming up in the future. We're going to discuss that relatively shortly. But for now, I just want you to know what the term mean arterial pressure is. It's just the average amount of pressure that exists within an artery, typically a systemic artery. Very important clinically, as you'll see. And the last thing that I'm going to mention before I bring this particular lecture to an end is that the left ventricle is much, much, much more muscular than the right ventricle. If you've ever done a dissection, whether it's of a sheep, a cat, a human being, and you get to the heart, you typically immediately notice that the left ventricle is substantially more muscular than the right ventricle. And the reason is the left ventricle has to generate so much more force than the right ventricle does. Because the easiest explanation for this is that the systemic circuit is so much larger than the pulmonary circuit. The systemic circuit is quite literally almost all of the blood vessels in the entire human body. The only thing that the systemic circuit doesn't include is the pulmonary circuit. Okay, so the systemic circuit is a massive network of arteries and veins, taking blood to all of the different tissues of the human body. And the left ventricle has to generate enough force to push blood throughout the entire systemic circuit, which is absolutely massive. The biggest thing here is when you have a really long circuit, there's lots of what's called resistance that the left ventricle has to overcome. And because of this, to be able to pump blood to the entire systemic circuit, which is incredibly long, the left ventricle has to be much, much more muscular than the right ventricle, which only needs to pump blood to a very short circuit where there isn't as much as what's called there isn't as much of what's called resistance within the pulmonary circuit. The pulmonary circuit is much smaller, it's much shorter, and thus it's much easier for the right ventricle to be able to pump blood into the pulmonary circuit, so it doesn't need to be nearly as muscular. The big picture here is the left ventricle needs to be incredibly muscular to be able to generate enough force to pump blood throughout the entire systemic circuit, which is incredibly large and long. The right ventricle can be a lot less muscular because it doesn't need to generate as much force because the pulmonary circuit is so much shorter and smaller, right? It doesn't need to generate as much force to be able to pump blood through a very short or small circuit. And this concludes the first part of this chapter. The first part of this chapter was really mostly review of anatomy, but that is very necessary to do. It's very necessary to review anatomy of the heart and the cardiovascular system because understanding the physiology of the cardiovascular system is basically impossible if you don't review some of the anatomy. So the next components that we will get into and topics are much more physiology based and far more complicated.